Hi folks, this is Isaac Tukpah Jr. I have with me Mrs. Natalie Tukpah, my wife. She's a healthcare professional, and we're about to have a little bit of discussion on healthcare in Liberia. She made a trip to Liberia. What year was that?
2009.
2009, and she was exposed to some medical facilities as well as some medical professionals. So can you just give us a summary of your experience with healthcare in Liberia? Just a high-level summary.
Well, I went to visit 3 hospitals in Liberia, and my first impression was a little shocking with the whole healthcare environment, for one. And, just going on some of the wards, there were no sheets for the mattresses. Some of the mattresses were badly damaged. And just imagine, a patient having to receive care on the mattresses was not optimal for care. They also had some issues with the gloves, which was not available for the staff, and actually I observed gloves being held to be dried from being washed. So they actually reuse the gloves.
So is that healthy at all for them to reuse
No, it's not.
latex gloves?
No.
But what was your impression in terms of Liberia being one of the primary exporters of rubber? What was your comment? Do you remember what you said?
Yeah, I said that by the country having rubber, why are they not producing gloves since they have this product right here in their country? That should be one of the number one things that should be readily accessible to all of the healthcare.
From an economic perspective, it's about downstream linkages for those upstream sectors like iron ore, rubber, and hopefully very soon petroleum and oil. But now back to healthcare. So you managed to get exposed to healthcare in Liberia, in 2009. I mean, do you think there was any level of priority or focus on really providing good healthcare?
No, I think that they do the best they can do with the resources that they have.
When you say they, you mean the people who work in
the people
healthcare?
Who work in the environments. They just have to do the best that they can do with what they have. And what was so touching was the nurses, when they have go into their clinical environments to get the skills they need to receive, they have to buy their own gloves. And so if you don't have any money to purchase the gloves, then they were actually caring for these patients with their bare hands. So that was putting themselves at a high risk for infections and other serious illnesses. So I mean, it was a dedication on their part, but it was a risk, overall to their health.
Okay. So you managed to go to 1 or 2 facilities, I think, and then I think you did a presentation at one. I mean, what's your healthcare expertise?
I'm a nurse for 23 years. I specialize in wound care. I'm a wound care specialist, consultant, and I've had a various background in all fields of nursing, just about. So pretty wide experience.
But were you able to share anything informational, educational with the folks there?
Oh yeah. We had a nice little presentation on wounds and assessment of wound and treatment management for wounds, and it was very, very productive. The nurses received the information very well, and it was very informative for them.
But do you think what they had to work with for wounds is what a regular professional will work with?
No. Actually, they wanted me to do. We actually did rounds on patients, and my expertise actually just was really stopped at a certain level because the things that I had to offer, they didn't have the things available for the treatment.
So you want to say the working environment was kind of primitive in terms of not being modernized and having the kind of stuff you need to treat people?
Yes, they weren't up to what's going on now with the current treatments for wound care.
In terms of both methodology and equipment and supplies?
Yes.
So what do you think if you try to project 10 years down the road, like let's say if you go back to visit Liberia, what would you like to see about healthcare?
I would like to see some of those things available for the staff members in the healthcare environment. They need to have access to some of the treatments that are currently being used in the 20th century, not what we used 20 years ago.
And I know you talked to some of the nurses about the books that were available to them and maybe some of the protocols they use, and it seemed like there was nothing there.
No, they didn't have a lot of the educational materials. The nurses had to share their textbooks for studying, so they were lacking the resources of the textbooks to really receive their education from.
Right, and I know you were touched by that, and you came back and put together some effort to.
Yep, we did a nice book drive for all medical and nursing textbooks and journals and all the information. We received a lot of journals, well over 300 books we received, and sent it back to Liberia. And from that, the hospital with the nursing school, Phoebe, they actually created a medical library with the books that they received for their medical staff.
Great. So now there's a renewed focus on healthcare in Liberia, and me and some other colleagues, some doctors and other healthcare professionals and other people of interest are trying to bring more pressure to bear on the system, because over the last year about $130 million was spent on healthcare in Liberia. I mean, those are hard numbers, $130 million. And it hasn't really moved healthcare, in terms of where people want it to go. People are still dying, from preventable causes. There's no real diagnosis at the most frequent hospital. Basically, the most patients or the most Liberians visiting the JFK hospital. So what are some of the things that we could do to try to push government, you think, from your perspective, to be able to put more into healthcare? What are some of the examples from healthcare that could be brought up to the surface to be able to get people to respond to what we are trying to do to improve healthcare in Liberia?
You first need to look at what's going on in the hospital. You need to collect data on the mortality and mobility rates of the various different types of illnesses, the length of stay that people are in the hospital, and some of the conditions that's causing them to be coming back to the hospital once they've been discharged. So I think a lot of data needs to be collected as to how care is being provided in the environments right now, and that will drive on what is needed as a priority in the facility. If it's infections, it's a high rate of infections, then you need to kind of zone in on infections, things to cut back on infection. Gloves, cleanliness, hand washing. You need to do a campaign on things like that. But you gotta really look and see what's going on in the actual hospital setting with the data based on the population that they receive, the different type of illnesses that they are being admitted for and cared for.
Okay. So when you say collecting data, technology is not a big thing in healthcare in Liberia right now, and they are trying, I think, to collect information. So, for example, they have some information on child mortality rates. I think they probably have some morbidity and some, mortality statistics. I think most recently, the child mortality is like 73 to 1,000 up to 5 years old. You think that's, how do you consider that? Is that too high? You think that 73 out of every 1,000 births don't make it past 5 years?
Right. So when you have things like that, you have to look at, prenatal care. Are these parents getting prenatal care?
What does prenatal care mean for a parent to get it? You mean breastfeeding your child, or?
No, it just means the care that a mother of a child that she's carrying. There are certain types of things that she needs to have throughout the pregnancy.
Okay.
So, in efforts to decrease mortality, if that mom is getting prenatal care Is she getting the proper vitamins, proper screening tests throughout the pregnancy to check for any type of elements before the baby is delivered that can help cut back on some of the mortality.
So if we go into a lot of prevention, it will make a difference on the back end when people do come to have their babies and stuff.
Exactly.
I know one of my doctor friends has been pushing for vitamin C, an increase in vitamin C, providing vitamin C for people. Do you have any knowledge of what the impact of adequate vitamin C in the system can do for you?
I mean, that can also help build up your immune system. But there's other, multivitamins that are included in the prenatal vitamins that the mother will need as well.
Okay.
But that's just one that will help as well for the immune system.
Okay. We know you are very busy in the process of trying to complete your nurse practitioner degree. Can we get a commitment from you to probably make a trip to Liberia to, help out people, maybe on a biannual basis, every 2 years or so, because it's been since 2009. I think Liberia should be like an adopted home for you, being married to a Liberian. So can we get a commitment from you to, go back to Liberia if we try to organize a medical, trip or group of professionals to go back? Can we expect you to be on that maiden voyage?
If it's financially feasible.
Okay. Yeah, that's one of the major things, the fundraising aspect. So we'll definitely be looking into that, and we'll be calling on you. We are also thinking about creating a hotline, like a second opinion hotline. Will it be something you if we could get images of wounds and stuff, will it be something that you can use your expertise and probably diagnose or analyze, some of those images and provide some kind of consultation for people?
Yeah, but there's a lot of limitations because of the resources that are available.
But if we get the image, if some way we can get around getting the software, getting the technology around it to be able to, upload the image up to some website that you could look at, or maybe other professionals, you think that way providing a second opinion could be, facilitate a little bit easier and support the current healthcare structure there?
Well, the only thing, like I said, it's kind of difficult when you're dealing with wound care because it's the ongoing process for one, but you need to have at least a basic supply of treatments. So if I'm going to be making recommendations, you need to have those treatments available to you. So if it was a site that we use as a hotline, we would have to make sure that we get the proper resources to that site. So when I make those recommendations on those wounds that are presented on the hotline, then I can say, hey, go ahead and put this on, go ahead and put that on.
So what you're saying, the professionals back in Liberia would need to be able to have the kind of medication or the kind of care you would recommend to. Okay, all right.
Well,
so
because right now, from what my experience is, there was only maybe 2 types of treatments that they provided.
for any kind of wound.
Yes.
Wow, that's limited, right?
Really.
Okay. All right. So before we close, the last thing I would probably like to hear from you is it, because a lot of people say hygiene is one of the major reasons why there's a lot of diseases, and because people are not aware about how to be so much hygienically conscious. So is it possible for us to do these little pieces now and then for you to provide some tips on hygiene and how people can be more focused in terms of washing their hands and using sanitized stuff?
Sure.
You didn't sound too enthusiastic there, which is too quiet. But seriously, thank you. I appreciate it, and I'm sure our listening audience will appreciate you being able to contribute your time and your effort, and hopefully we can do more of these spots where we can engage and talk about healthcare in Liberia, and maybe some other things. So thank you for participating. Now I'll ask my beautiful daughter Nyla to please turn off that video for me, Nyla.